More than 700,000 Iowans benefit from Medicaid, with about 250,000 of them living in rural areas. If passed, the so-called One Big Beautiful Bill Act that's now in front of the U.S. Senate could mean hundreds of billions of dollars in cuts to Medicaid spending over the next decade. KTIV's Connor Trent spoke with the Northwest Iowa Hospital to see what this could mean for rural hospitals across the area.
As of January of this year, over 70 million Americans benefit from Medicaid.
Medicaid covers children and older individuals, pregnant women, and through Medicaid expansion, those individuals who are up to 133% above the federal poverty level.
Medicaid is jointly funded by the state and federal programs to provide necessary health care. In the state of Iowa, for every dollar spent on Medicaid, 63 cents comes from federal dollars and the remainder comes from state funds.
So if you're making a significant reduction to that 63 cents, you can really look at what the potential cuts might do. It could lead to state budget shortfalls and really have states looking at, really, do we consider changes to benefits? Do we change the reimbursement, or do we change who's eligible for those programs?
Our costs for supplies have went up. In the state of Iowa, it's went up on average 12%, pharmaceuticals 40%. Labor costs are up almost 20%. And so when you have all of those costs that are going up and you're seeing less money coming in from Medicaid or insurances, it just doesn't compute when the margins are already so slim.
Now, for Crawford County Memorial Hospital, Erin Muck says that about 1/4 of their patients are on Medicaid and about 11% of them are completely uninsured. Now, she says that if these proposed changes were to go through as is, that number of uninsured patients would most likely only go up, which would cost the hospital more money in operating costs.
And when people do not have insurance, and they present to the ER, we still see them, and we end up with quite a bit of bad debt and write-offs related to those people that are either uninsured or underinsured. This year we'll probably end up about $2.5 million that we'll have to write off. And then you continue to perpetuate that by less people on Medicaid. It gets to be more difficult.
Now, the House bill is still being considered by the U.S. Senate, and until there's a final version, we won't know exactly what the full impact could be in terms of Medicaid spending. Members from the Iowa Hospital Association have lobbied the state's congressional delegation in an effort to preserve the state's directed payments program. Iowa hospitals haven't received a Medicaid rate increase since 2013, and by 2023, the national Medicaid shortfall was $27.5 billion. That shortfall is the difference between what it costs hospitals to care for a Medicaid patient and the payment the hospital receives for those services. The directed payment program was implemented in 2023 as a way to bridge the gap between the costs and the reimbursements. The supplemental payments have played a major role in stabilizing hospitals in several states, including in Iowa. 1 year into the program, the number of Iowa hospitals with negative operating margins decreased from 60% down to 28%. Members of the Iowa Hospital Association are looking to ensure directed payment programs are protected in this new bill that's in front of the U.S. Senate.
We believe, since some House members recognized how vital that funding is to the healthcare delivery in their state, they wanted to try to do something to allow states that are using it to maintain that critical funding source.
If the House's version of the bill is approved by the Senate, Iowa's program could be grandfathered in.